Hello, this is Dr. Maddy Roth with Roth Consulting Group. Today we're going to talk about packages. I hear this question all the time. Should I do packages at my pelvic PT or OT practice? I really feel like each clinic is a little different and what works well for one might not work well for another. Some of it depends on your location, who you have on staff, and a whole number of reasons. All right. So some of the pros of doing packages. If you read the research on pelvic health conditions, the research is actually stating that typically 8 to 12 visits is where patients are getting the best clinical outcomes for conditions like leakage, pelvic pain, low back pain. Okay, there's some variability. Some studies say more, some say less, but that was the resounding answer when we did this deep dive into all these different studies as a practice. So I would argue that we need to use the research to guide how we're treating patients. And I think it gets a little willy-nilly if we're just saying, okay, I know the research says 12 visits for leakage is about what we want, but I'm just kind of taking it week by week with patients. Let's see how it goes. And one, I think packages can be very research-based. And that's what we do at our clinic. Our main package is a 12-visit plan of care based off of the research. Okay. I think having packages is less salesy than going visit to visit. And let me break down why I think that is. When we have patients that come in, we do an eval and we recommend a plan of care. Okay, they have leakage. We're going to go off the research. Let's do a 12-visit plan of care package with them. If they're paying up front on that first visit, yeah, okay. Feels awkward, 2,500. Yep, okay, done. It's over. Any sort of money conversations from that point on are done with. It really takes the pressure off of the clinician and any staff members. Like, okay, they've already paid for their plan of care. I don't have to be freaking out that they're going to drop off at any moment in time. Yes, we want to be doing our due diligence, but my clinicians that I have on staff and me, we're kind of high stress and we try so hard. And I think it gets really nerve-wracking if you're trying to sell the next visit at the visit. There's so much pressure to be like, okay, like, well, I know they're on visit 10. They're doing really well, but I know if they come back, like I can get them the next step better. But from a patient side, the patient might be thinking, yeah, like I know she's saying she can get me a little bit better at the next session, but you know what? I'm actually kind of fine where I'm at now. Good enough. I'm pretty much better. I'm just going to call it a day. Because it's human nature to take the easy way out. So I think possibly outcomes could be not quite as good if you're having to really sell it. And even if you're so good at like clinical buy-in and having patients so excited for the next session. Ooh, we're going to do cupping next session. Oh, we're going to do this. It's going to help so much. Okay, people are lazy. So let's just say it. If they're pretty much better, there's a good chance they could drop off if you haven't sold them a package. I'm sure you could argue it either way, but I think it's actually more clinically relevant to sell packages because you can go straight off the research, don't overcomplicate things. That's what we're doing. I think it's less salesy to do packages. The sale is done on the first visit. You never have to talk about money again. You're never charging their card again. If you're having to charge every single session, it actually makes me more nervous to do that. I also feel that having packages can make you seem more confident too. And I think it depends on the clinicians, but especially for a little less experienced clinicians, I think having packages at your practice is really advantageous. So I will say that might be the only practice I wouldn't recommend packages is if you're solo and you're so confident, you have a lot of experience, you're just great with buy-in, hey, packages might limit you a little bit. If you're great at getting patients, you're BFFs with everyone, they're coming in taking your confidence and running with it. But if you have staff, there's a lot of different personalities. They don't have that next level of intensity for needing to get patients. Yeah, they want to get patients better, but it's like, they're also like, especially if they're salaried, you know what? If they don't come next week, that's fine. I think it helps exude confidence, and with staff, I really think it's so much easier if you have packages at your clinic. So let's talk a little bit more about the confidence. I think having a protocol is actually very similar to what doctors do. For example, I have a really rare tooth issue. It's called internal resorption. It's from trauma, but basically the inside of my tooth's eating from the inside out. It's like having a cavity in kind of the root of your tooth that eats its way out. It's not from eating sugar or whatever. So I have a protocol that I'm going to be doing. I'm going in, I'm going to meet with the surgeon for a visit. We're having my assessment, and then I'm going to have my tooth extracted. They're going to take a bone graft from my nasal cavity or something. And then after that, I'm going to have an implant. And then I wait 3 months, wait for the bone ossification to occur. And I'm going to have a crown put in. So it's very systematic. You know how many visits it's going to be, and you're going to have your problem solved. I really think patients, yes, we know as clinicians, the human body, there's variability between people. We can't really say a patient's going to be better on visit 12. Okay, that's just ridiculous. None of us learn that in PT or OT school. But for patients, they like knowing. When I switched to packages, it just was so much better. Patients were a lot more confident, like, I'm going to actually get rid of this, and at visit 12, I'm going to be feeling this way. And luckily for pelvic health, I mean, we get great outcomes. Like I said, I don't know if I just wasn't great at ortho PT, but for pelvic health, most people are getting their issue at least almost all the way resolved by the end, if not completely resolved. I mean, there's a few outliers, but typically in line with the research, around that visit 12, patients are better. They're going to have symptom reduction around visit 6 to 8. Of course, that's when people are going to want to fall off. So having a treatment protocol and telling patients, okay, it's going to take 12 visits to get this issue resolved. It's based on the research. I know all of the clinicians want to go on research. And this is what it's going to look like. The first 4 visits are going to be this, the next 4 this, the next 4 this. Patients like that. They like knowing what to expect. For us, obviously we know, okay, the first 4 visits, it might not exactly look like that. Visit 3, we might have to shift gears a little bit. But typically by visit 12, we're doing great. Going off of that, it doesn't have to be finite though. I know people are nervous about, say we're going for 12. It doesn't have to end at 12. And I know the concern with that is, well, we sold them an 8 or a 12 visit package. Are they going to want to buy another package if they've already bought one? Probably not. So they're going to leave and they're not quite all the way better. But I think as long as you have really clear communication with patients, and we'll even say on the first day, like, hey, we are recommending our 18 visit plan of care, which we only typically bring up to patients that are really, really complicated cases, chronic conditions. But you've had this issue for 10 years. We're probably going to need more visits than that. And then as you're going along, it's not like on visit 18, you're like, we ran out of visits. You're not better. Do you want to buy another package? It's more like, okay, visit 14. We're like, ooh, this is taking more time than we realized. But we verbalize that to the patient. We're saying, okay, you're not quite where we want to be because of these factors. Maybe you had a trauma history or whatever, or you have bowel, bladder, sexual, like every pelvic health issue. So I'm anticipating we're going to need a couple more visits over the 18. Patients are fine with that. We do that all the time where patients are adding on another visit. We're not selling them a whole new package. They're kind of brought in at the same rate. If the package price is $195, they're done with their package. Okay, they can pay for the next visit, still $195, even if they don't buy it as a package. They need 2 more visits, another $195. So it's not really a problem. Another question I hear, and especially when I'm training new staff members, is, well, what if the patient, you think they need 12 visits, you sell them a 12 plan of care, and they don't end up needing 12 visits? I will say, I've never had a patient complain about that. When I have patients that get better on visit 10, I actually had a patient, she's like, well, I cannot believe I'm better. This is amazing. And I was like, I am so happy. Like, you have IC, had a lot going on, and totally symptom-free, knows how to manage all of her issues at home. She's on visit 10. I was like, you know what? We can use these visits the next 2 months just as monthly check-ins, and we'll rework your home exercise program. And she's like, you know what? Nah, I'm fine. I'm just so happy I'm better, and I'm happy I'm better faster than the research shows and faster than you anticipated. So I think it's interesting how Greg Todd explains his plan of care to patients. He's really big on solutions-based offers. I don't think I'm mentally quite there yet, but what he typically does, and I'm sorry if I'm getting this wrong, I'm just relaying what my colleagues have told me that have worked with him. So what he does is he says, all right, you're going to pay $2,500 to stop peeing your pants. And basically, you work with the patient as long or as short as it takes to reach that solution. They liken it to braces. Like, you're going to pay $6,000 for these braces. Some people might take a little longer. Some people might take a little shorter. People are happy when it's shorter. And it's not like a massage where you're paying for the clinician's time. You're actually paying for the solution. So you can kind of think about packages a little bit like that too, where that patient, I mean, is she really paying for my hourly time? Really, she got the solution a little bit faster and she was really happy. So I really think from a new clinician standpoint, having packages just makes it so much easier. Instead of the tendency for clinicians is to usually undershoot how many visits people are gonna need. So a new clinician, they might say you're gonna need 6 visits to get better, even though we know the research isn't supporting that. And they might be saying that, one, because they're having some money mindset issues and they're nervous to say they need the full 12 visits. Or they might be saying that because they just really don't know how long it's going to take to get their problem resolved. Or maybe they had one patient that got better after 6 visits, or they thought they got better after 6 visits. So I think for newer clinicians, and for training purposes, and from a business perspective, it's so much easier to have packages. My clinicians know, like, this is just what we're recommending. It's based on the research. It's the end of the story. That's where I do think some practices, especially if you're solo, you're really confident, you've seen a lot of different cases, I think if that's you, packages may not be your best route. You might actually limit your visit average because you're giving a standard amount and possibly everyone actually needs 13, but you're like on visit 12 and you're like, pretty much, I probably don't need to do one more. I'm not even going to bother with having them come for another. Something like that. But I think experienced clinicians are just more like, I've seen this before. I've seen someone with this chronic pelvic pain condition, and you're going to be seeing me for the rest of your life, and then monthly after that. And patients are like, yep, that's fine. I'm bought in. But if you have really new clinicians that are like nervous and they don't know what to recommend, they're probably not going to be busting in the room just being like, all right, you're going to be here forever. Like, your pelvic floor is pretty messed up. So that's the bonus of having experienced clinicians. Another reason I love the packages is I think clinicians, especially PTs, I'm sorry, we have a little bit of a pride thing going on. And there's a lot of glory and pride in PTs, especially maybe some OTs, but us as clinicians, we think we can get patients better really fast. So I think as far as staff training, I think that's why packages are really helpful too. Not only from a new clinician's perspective, but if you have a really seasoned clinician coming into your clinic, they might think, I'm better than this world. I can get patients better in 3 visits. Like, okay, that's not research-based. Leakage doesn't get better in 3 visits. Yeah, you can make a big difference and have significant symptom reduction, but is their leakage gone forever after 3 visits? Are there prolapse? Probably not. I'm pretty skeptical of that because that is not even backed by research. So I know every person and every body is different, but I think there's a little bit of a pride thing going on with I can get patients better. And I was talking to some business owner friends about visit average, and one of the girls was saying, my visit average is 4. And she's like, I think I'm just really working myself out of a job because I've taken tons of courses and I can get patients better so quickly. And I was like, yeah, you're amazing. You must be really good. I actually just went with it. I was like, I'm not going to tell you, like, yeah, right. So I think that's a little bit of an issue too. And having the packages really eliminates that sort of pride issue getting in the way of recommending visits, especially for staff where booking patients out isn't actually putting food on their table. Like a lot of times if they're salaried or have some sort of pay per patient structure, they're a little less like, they're more thinking about it like, I can get this patient better real quick. As far as the sales part, we have an eval script and our clinicians don't have to think about it. This is where I'm pretty strict. Stick to the script, people. That's all you have to do on the eval. You can say whatever you want in follow-ups, but when we're presenting the plan of care, I have my staff stick to the script. And that has really helped with, we're growing so fast, we're constantly adding more clinicians. I'm planning to add more locations. It's just so much easier for training. This is what we say, this is what we're recommending, and we're shooting for, a 12 visit plan of care for every patient. Some patients are going to be a little higher, some lower. Okay, so training purposes, and we just have our eval script. I mean, they go about, do their subjective, objective part of the eval, and then the wrap up. It's just the wrap up that's scripted. So basically, they're saying, okay, based on this, during your exam, and because your goal is this, I recommend a 12 visit plan of care. It's going to look like this. The first few visits are going to be this, done this, done this. And by the end, we are going to get you to jumping without peeing your pants. So you can spend time with your kids without worrying about wearing pads. Okay, so that's actually scripted. They're saying what they're going to do. They go back to the patient's deeper why, like, why is this patient actually here? And now it's just 2 options. Okay, so since I'm recommending the 12 visit plan of care, we have 2 different options for payment. You can either pay visit to visit, and your visit's $227 if you would like to pay that way. Or we have a package plan of care, which drops your visits to $195. Which sounds better to you? Look at the patient. Look them into their soul, with your eyes. Okay, then the patient just says what they prefer. It's really not that hard for training staff. It's about 2 sentences long. You give the patient the 2 options. If the patient's like, then you just say, it's okay. Well, we can chat about it more at next visit. If they're like, yep, let's do it, sign me up, then, book them out, charge their card, and you never have to talk about it again. If they're like, I'll do visit to visit, that's fine, then you do that. and it's just like any other clinic that's not doing packages. But there's that added pressure then, because they can drop off, and if you're not doing your due diligence or you have an off day and you're not feeling perky, they might not come back. Now, we talked about it from a clinical perspective, from sounding confident. This is the protocol. This is what people are doing. And we talked about it training-wise. So much easier, especially with new clinicians to pelvic health. Okay, the last thing is from a business perspective, where pelvic health actually, I was looking online one day, it has the highest cancellation rate, no-show rate, compared to any other specialty of PT. Sorry, I know it's OT too, but the research I found was on PT. So, and it's just true. I mean, these moms, they have kids that get sick, and then they get sick, or whatever. There's issues, but if you already have the payment up front, it's a little less stressful when the schedules shift around. Next thing, from a business perspective, yes, I want all my patients coming in for all their visits in their package, but life is interesting, and people like to spend money, actually. So this is basically like a vacation for the pelvic floor. We have patients come in, are all excited, they buy a package, and we never, ever, ever see them again. We call them, we text them, kind of stalk them on Facebook, like, are they alive? Yep, they're alive, they're posting. They just didn't come back. We've had other patients buy a package, come for a few visits. There's one guy that came for a few visits, great relationship with Dr. Heidi, our PT, and after a few visits was like, you know what? I'm actually going to get my foot surgery done, and this really is not a huge priority for me. I'm going to cancel the rest of my visits, and I'm a business owner myself. You don't have to worry about refunding me. I get it. So end of story. He's gone. Yeah, I mean, occasionally we do have patients ask for a refund. I mean, it can be, I think I saw something online, someone posted, should I give a refund? My patient had a miscarriage. Yeah, you should probably give a refund, you know? So sometimes you do. I mean, obviously, you want to have a buffer in your bank account. You don't want it to be like, ooh, I got to refund this and it's going to tank me. It really shouldn't tank you. You have more people not using their package than people asking for refunds. So I was trying to run a report on our Jane EMR just to see how many people have unused account credit. It doesn't let you run that report, but there's a ton of people. Yeah, I mean, people just get bright ideas and they just, yeah. It blows my mind a little bit that I would never do that, but I'm tight with my money. I would never just blow that kind of money and never come back. But, okay, so if you have that several people that do that, and it sounds crazy, but it's going to happen, you're actually getting paid double for certain hours of your week because you filled that spot with someone else, but someone purchased a package. I remember the first week of Dr. Marissa, my pelvic OT, and she had a patient that she'd come some weeks, other weeks she just wouldn't come. We just pulled from her account credit. She didn't even feel the no-shows. Eventually she just kind of stopped coming, but yeah, she'd just come in like, oh yeah, I missed the last 2 weeks. What? And then she came for probably 6 visits and then just has that account credit, and yeah. So that's pretty cool, I guess. I mean, obviously we want people coming in and getting better, but that's not the reality. And it's great to be paid twice in an hour. Also, so patients we find are the most fired up when they first come in. They're really wanting to get the issue fixed. So I think when we get the buy-in or commitment early on, patients typically do better. So patients that purchase packages at our clinics, they're always our best patients. They trust us. They go with our clinical judgment. They're the ones that write us the Google reviews. They're the ones that get great outcomes. So I think there is something to that, a little, maybe even a little placebo. Like, I'm going to do this. I'm committing. I paid my hard-earned money and I'm getting better. I don't care about anything else. Okay, there can be back to business perspective, on the negative side, there can be a cash flow issue. So maybe 1 month you're really high, 1 month you're really low. Now, what a lot of clinics are doing, I see this really common in the ortho world, is people are doing payment plans. So that's actually a form of a sales tactic where people, they don't want to go for like the top tier thing, but it's kind of like a downsell, but you're still getting them to do the action that you want them to do. So we recently added payment plans. So people feel like, ooh, I want to get this deal, but should I be doing this? Is this responsible? Hey, we can do this as a payment plan. So patients pay in 3 lump sums, and that solves the cash flow issue. I think those are my main points. So all in all, I think some practices would do well to add packages, and I think it's not really a one size fits all. It works great for our practice. I love it, especially since we run Facebook ads. I can quickly see our ROI on it. Okay, this month we paid $600 in Facebook ads, and 10 of these evals bought $2,500 packages. So we're at $25,000 from the $600 I put in Facebook ads. Cool. It's like really fast to see your ROI on your ad spend. So that's kind of helpful. But anyway, all in all, works great for our practice. I think some practices would do really well, especially with newer clinicians. Like I said, if you have really experienced clinicians, it could cap you a little bit. So I think that is something to keep in mind, and maybe you try both. Maybe you try for a while having packages and then just compare your visit average to when you have no packages. Obviously, the most important thing is clinical outcomes, and that's why the packages that we offer at our clinic are based on the research. Thank you so much for listening. I'm sure there's differing thoughts on this. I just know that there's different ways of doing things, and I love the packages. It's great. It's so much less awkward. Get the sales out of the way that first visit, and you never have to talk about money again with patients. I hope you like this topic. I hope it got you thinking, and just thinking about that at your clinic, it might be a little different than what other clinics are doing, and that's okay. So you got to look at it from a clinical perspective and a business perspective, and I think you'll come up with the perfect solution for your clinic, and it can evolve over time based on who you have on staff or what your clinic looks like and what your goals are. All right.